Hi, Dave with Align Therapy here. We're going to talk today about why the wait and see approach doesn't work for scoliosis. If you don't know what the wait and see approach is, it's how scoliosis is usually treated in the US especially. It's someone's diagnosed with scoliosis, whether that's adolescent or adult, and the thought is, oh, you have scoliosis, let's wait and see if it gets worse. And then you wait and see if it gets worse, and it gets worse. And then we continue with the wait and see approach, and we do an x-ray in 6 months to see if the curve has gotten worse. So the problem with that is it's not really treating anything, it's just monitoring things. So it's not a wait and see treatment approach, it's kind of the absence of treatment. So that's, the main reason I don't like the wait and see approach. But let's talk about a couple of other reasons. So with scoliosis, we have a curve that is a structural curve. So let's see if I can draw it on here where you can see it. So we have a spine that's curving, right? Maybe you can't see that very well through the camera. Ooh, that one we can see better. So we have a spine that has a curve to it. So say in an adolescent patient, we have that curve. The bones are growing, the vertebrae are growing on the ends of the bone. And the more curved we get, the more asymmetrical that growth becomes. So we have more growth on the convex side of the spine and less growth on the concave side of the vertebrae. And so the longer that stays like that, and the more the child grows, the more it progresses into the curve. So if we're waiting to see if this gets worse, anatomically and physiologically, the curve is going to progress because of that. So that's something to be aware of. If we don't do something with that, then we're just biasing it towards the curve. A brace will push in on the curve and bring it back towards midline and reduce the rotation. And that can help reduce the curve progression as well. And bracing has been supported in the research. But scoliosis specific exercise does the same thing, but it also helps to expand the concavity, it helps to elongate the spine, and in the research it's been shown to be effective. So if left to its own devices in an adolescent scoliosis patient, it's going to progress how it wants to progress. So why not do something about it with bracing or scoliosis specific exercise? In adults it's the same thing, but instead of growth we have degeneration and kind of a collapsing of the spine. Not collapsing, but degeneration and arthritis that's contributing to the curve progressing. Left unchecked, if we're just waiting and seeing if it gets worse or we're observing it, it's going to progress and it's going to get worse. So why not do something that's effective and shown to be effective in the literature and in the research to help reduce the curve and give the best outcome possible. So if you're someone that has scoliosis, or you know someone that has scoliosis, and you've been told to wait and see if it gets worse, or wait and see if you need surgery, or wait for your next x-ray that's in 6 months to see if it gets worse, take the reins and do something more about it. Subscribe to our channel. You can see some of the other videos that we have about scoliosis specific exercise. You can get other advice from support groups and things like that, but do something. Take the reins and don't just wait to see if it gets worse. Do something that makes it not get worse. Hopefully this was helpful. This is kind of a soapbox topic that I have, that we shouldn't be waiting and seeing if it gets worse. We should be proactively treating the spine, and that's what we're here to do at Align Therapy. So thanks for watching, and until next time.